Namaste to everybody. Um, it gives me immense pleasure to be here on the 52nd International Conference focusing on Ayurveda and eye care. A very sincere thanks to Apna, Dr. Shekhar Anabotla and the team for making this possible. I would be speaking about vision and eye care from preconception to old age, Ayurveda aspects of prevention, promotion, and preservation of vision. I am Professor Vaidya Shantala Priyadarshini, visiting professor at the University of Latvia. I would be grateful to the Government of India, the Ministry of Ayush for deputing me to Riga, Latvia, and a very sincere thanks to all of you for giving me this patient listening. It is the focus will be on the first slide, like protect your eyes, it shall protect you. We hardly really give thought on this. We really need to protect our eyes always, as it is the one which will protect us. Vision and eye care from preconception to pregnancy is what we are going to speak for a few slides now. During pregnancy, neonates, infants, young adults, and aged will come next. So, promotion and preservation, whole life, food, lifestyle, special plans will all be included. Prodromal stage to manifestation to late stage of conditions. Plans like climatic vagaries, environment, age, stage, personalized management. Ayurveda speaks about everything. It also speaks about Drishti Visharada and Naina Chintaka, which are the specialization of eye care. So it also includes yogic aspects like meditation and routine like dinacharya, rutucharya, and all that. We have Shalakya Association, the Association of Shalaki. From many years, they have been conducting conferences and trying to disseminate knowledge, which is a very much essential aspect today in Ayurveda. So here it would be like sharing my experiences of 3 decades and more. Janmabala Pravritta is congenital anomalies, which Ayurveda speaks about as different causative factors. Janmabala Pravritta is not only spoken about, but it also speaks about how it could be prevented. Before conception, um, the parents to be need to undergo panchakarma. The cleansing of both the sperm and the ovum is advised. So panchakarma is advised. Then putra kameshti yagna as in Ramayana. It is not only putra, it is putra and putri. A wonderful progeny is what everyone seeks for. So Garbhastapana Aushada, Pumsavana Karma, Vedic chants, Garbha Samskara Mantra, Naga Pratishta, you have so many from of the Vedic rituals which really need to be taken care of, explored, and scientifically, if possible, explored. Sushruta Samhita, the ancient text of Sushruta, speaks about um, what type of food to be taken and what should not be taken. The expectant mother should not take excessive salt, should not indulge in alcohol, drugs, and all that. Apart from that, the emotional aspects of the mother to be has been given a lot of importance. In the third month, Sushruta says specifically what diet should be taken, and uh, we find that being happy, the whole family needs to get involved. So, a conception before conception, parents need to conceive what type of baby and what type of the family should be there. A happy family is going to create a pride. A baby is a family's pride and responsibility. A person, a expectant mother who keeps drinking alcohol and drugs can definitely cause a lot of uh, harm in the society, because 40,000 babies have had their first drink even before they were born. And that is going to cause alcoholic fetal syndrome, alcoholic fetal anomalies. Sushruta speaks about why alcohol should not be taken. Apart from that, excessive salt should not be taken consumed by the mother, expectant mother, because we find in our practice that a child born in a family wherein excessive salt is consumed can result in blindness. Then we find that what Sushruta has been saying is right. We have um, restrictions like Nasya should not be done in Garbini because it results in malformation. Then, in morning sickness, we have been advised to give Madhifala Rasayana, which is giving nutrition not only to the baby but also to the mother. It is a nutrition, a holistic food and nutrition, a medicine, so that it stops morning sickness. It nourishes also. Then we have here a neonate whose mother was not highly educated. Cleanliness, nutrition are all very poor. So we got this neonatal conjunctivitis case, a 3-day baby. Then we had to give education to the mother and the family, how to take care, how to keep cleanliness, and all that. So it was a challenge for us also. Then we had a case of a 7-month-old baby wherein uh, dantodbhava, that is dentition, was happening. When dentition happens, the baby's digestive system is also very weak, and the mother needs to take really very good care, because Kukunaka, explained as Kavaja Abhishanda, is to be taken care of by both the cleansing both the mother and the baby. So this is a very good aspect when we come across kids of having dentition, how to cleanse both the mother and the baby to get very good results. Here is a 6-month-old allergic kid, wherein we had they had gone to before coming to Ayurveda, they had gone and they were advised anti-allergic drops and steroids for lifetime. But because the patient's father was also my patient and he had awareness about Ayurveda, he brought the baby to us and we started treatment before um, long. So we got very good results, and in no time, baby's allergic manifestation cleared off. And that was the only time that the baby had this problem. After 3-4 months, it never recurred. So let Ayurveda be the first choice. We uh, treated only with Ayurveda. We treated with Stanyapana, Stanya being used as medication, and we had Bidalaka with Haritaki. We had Bala Chaturbhadra Rasa as Rasayana. Then Chakshushya Rasayana is a very helpful solution. Because of COVID, we were doing lot of teleconsultations, and here was a child whose parents both were Ayurveda doctors, and the baby got hurt, and there was bleeding, and we managed the baby only through Ayurveda. In every day we had improvement. So the photos you can see, and in 8 days the baby was fit and fine. There was no problem. They did not need to go to any other system of medicine. Then we had a 3-year-old twin um, who had some food allergy early morning, and in 36 hours we kept watch of the baby, and no histamines or antimicrobials were given. Bidalaka and fasting was the uh, treatment aspect that we did, and we got very good results, as you can see. Then we had Ayurveda going global. That is, wherein this case, like many other cases, we get repeated stay, and patient undergoes different types of management. And when it keeps recurring, they come back to Ayurveda. They know then it is past, it needs no surgery, no antibiotics, no recurrence. We have hundreds of cases. My friends in Shalakya would have many more to add. We have thousands of years of experience in Ayurveda. So, seeing is believing. We see that Ayurveda can do wonders in these type of cases also. In Bauer's manuscript, we find the Om Trataka. Mind and Vision book also gives this. It is we add up everything so that we get a very good treatment. Aditya Hridaya Mantra, Suryan Namaskara, because we know that benevolence of sun is needed for us to have very good vision. This is a case wherein we had 9 cases. We started treatment in the Pururupa, prodromal ocular manifestation, because these were either who were knowing Ayurveda, who really knew that initially if they start Ayurveda, then the results are very fast. As soon as they got some redness, some lacrimation, some inflammation, which is very mild inflammation, which is known as samramba in Ayurveda. So these type of cases came to us, and the treatment was very simple, but we got very good results. Here, if we treat early, results are faster. So people who experience it are saying Ayurveda is incredible. They are happy with the treatment. Here is a mild myopia, wherein we find many school kids, thanks to technology. Technology is improving. It has got the good aspects, whereas it has a negative aspect also. So myopia in school kids has been increasing because of the screen time, and we as start them on various holistic methods, and leech application that definitely helps. This is a kid wherein we started leech application because of repeated stye. When we come to management of prevention and preservation, we teach people Nasagra Trataka, Om Trataka, Jyoti Trataka, and Jalaneti, all that, so that the nasal passages are also good, the mind and the vision are good, mind relaxes and the vision relaxes. So both have an impact, and they have very good improvement of vision. Then we do teach them reading and reading rules, wherein you can see in W.H. Bates also. We also advise Jyoti Trataka using ghee lamp, lighting a ghee lamp and looking at it steadfastly. And in the meantime, in between, they also need to do palming. This is a case of recurrent chalazion. Um, this patient had 3 surgeries within a span of 1 year, and again it recurred. So he came to Ayurveda, and We are following up this case after treatment, after cure. He has been coming to us for infertility, and we see that chalasia has never reoccurred, even in 3 years. So it is a solution that Ayurveda can provide. Globally, we see eye problems are increasing because of excessive use, wrong use of eyes. You can see here everybody is engrossed in the screen, and it so happens that kids, even as young as less than 2 3 months, are looking at mobile before eating or while eating, and this is not a right way that the world is going. This was a case from Sweden. He was an Indian student doing his masters in Gothenburg. He had developed diplopia, dry eyes, and stress, and he was extremely anxious because all his blood tests become were showing normal, but diplopia and proptosis was still there. So he was advised surgery. So he became more anxious and came down to India. We treated him with very simple Anulamana, Shiropichu, Nasya Rasayana, and in less than 2 weeks he was totally fine, as you can see. So thanks to Ayurveda, we have a lots of options in Kriyakalpa. Panchakarma is always followed by Kriyakalpas. Bidalaka, Tarpana, Putapaka, Anjana. We have also different medicinal formulations. Kanapippali yoga diet involves a lot of things wherein patient can get much better benefits. Here is a case wherein orbital cellulitis can be cleared just by simple applications, topical applications, and foreign body sensation, foreign body removal also. Patients do come to us. As you can see, there was a foreign body here, and sometimes we just apply anjanas and it just comes out. But sometimes we have to do seka. Sometimes it is removed mechanically and then seka is done. Then it is usually said Chalisa. After 40 years, presbyopia starts. You really need to start wearing glasses and all that. But it so happens that aging need not become a permanent issue. We can create awareness. We can see how some people can have very good vision even at 40 or even more, but we need to be aware of what is it that we really need to do. Ayurveda management ensuring safe, effective, non-recurrent acute dacryocystitis. Acute dacryocystitis have been treating many cases, and results are very promising. If it is a painful case, lot of inflammation, then leech application is done. The Ashruvaha Nadi, Sandhigata Roga, we get a elaborate description of how this Sandhigata Roga should be treated. It is known as Puyalasaka, which means stagnation of pus. You can see here how stagnation of pus was all there, and we had applied a leech. Um, Patient became all right, and there was no recurrence of epiphora or any condition related to dacryocystitis. We have been following up the case for many years, and once they start with Ayurveda, they continue with Ayurveda, so the whole family becomes an Ayurveda person. Then we have to be very cautious about our negative emotions. We need to create awareness that anger, sorrow, worry, fear, controlling tears. These are some of the things which Ayurveda says need to be controlled, and the other aspect is what should not be controlled. That is, the natural urges should not be controlled. So, these are some things which we as Shalakya people need to create awareness to people and say that they need to be aware of what to do and what not to do. Here is one more case of Puyalasaka, wherein this lady did not have any extensive pain, so we could manage it with only bidalakas and uh, oral medications. No leech application was done. Then one slide on the history of Ayurveda, Dhanvantari Mahal, the first integrated hospital of 1777. Why I have put this here is they have recorded all the case sheets, ophthalmic case sheets, like 38 case sheets we can find in Saraswati Mahal Museum, wherein it is an ophthalmic prince, Raja Sarfoji. So he has given a great heritage. We need to check how history inspires. Shalakya people have always been in the forefront. The Shalakya Association of India is also doing wonders. So here is something wherein even in those days, a recording of case sheets, the precise way of doing it has been seen. Then when we have different types of retinopathies, diabetic, hypertensive. You have so many retinopathies, wherein Takradara could be a choice of management because it improves vision remarkably. Apart from that, it reduces stress, induces quality sleep, energizes eyes. So, this is one holistic management which helps in multiple ways. Almost all Urdhva Vikaras directly and indirectly has an impact on the whole body. Mm. All complications of diabetes, age-related macular degeneration, this could be the doctor's choice of management. Then we have food. When we speak about food, we have a lot of choices for different regions. Here are some. Licorice tea is very popular even in the West. It has to be taken with caution. And you have, as per the summer, you have coriander milk tea. We have different types of lassi. We have Kajura the manta, different dates and all that. Then, of course, the most popular turmeric milk is also very good for the vision. So that could be one choice for improvement of vision. Here is a very challenging case that I would like to bring your attention to. It was during the COVID time. The people in the family had COVID, and here was the lady with herpes zoster and COVID. So we could treat her in less than a month and give her total relief very soon. You can see the date. So here was the inflammation with pus and all that, and very soon she became all right. We did not use anything else, no antivirals, no biomedicine. She was put only on Ayurveda and yoga. Yoga is pranayama because she was already doing yoga pranayama. It was easy for us to include that in her management. Then Panchakarma is an essential part of treatment in Shalakya. Before the Kriya Kalpas, many Panchakarma therapies have been advised. So, Nasti Basti Samam Marma Paripalanartham means for almost all eye-related complicated cases, we have thousands of choices, thousands of combinations to do Panchakarma, the Basti. So it is here that you can see a small kid, congenital nystagmus, we could give her slight improvement in her nystagmus and very good improvement in her vision and a lot of confidence. So this was a case which many years ago was treated many years ago, and we see that the patient is so much better now. Then for small kids, again how the management should be conducted. All the what the adults get as treatment cannot apply for the small kids. So when we do treatment for the small kids, we have to be very cautious and do the treatment. And when Panchakarma is being done and we get marvelous results, but still there are rules and regulations to be followed. Or else speaking too much during Panchakarma, traveling during Panchakarma, and all that which should not be done can cause, can manifest blindness, glaucoma, um, and different eye problems. So, Ayurveda speaks about adverse reactions that could happen if Panchakarma is not done properly. This is two cases of optic neuritis. Multiple sclerosis cases do come to us because the initial manifestation could be optic neuritis. But we did give treatment, Panchakarma, and we got optic neuritis also well under control. The next MRI showed that there were no new lesions and there was no activity in the previous lesion. And patient was happy because vision had improved. This was a case of sulfur drug adverse reaction, the Stevens-Johnson syndrome. This patient still comes to us. He is on Ayurveda Yapya Chikitsa. The treatment is not stopped. He has to continue with the treatment, um, the regular Panchakarma and the Kriya Kalpas. To nourish, to achieve Vision 2020, we have this very simple formulation but very effective. It could be a choice for everybody who wants to improve vision. 100 grams of almonds powdered into fine paste and fine powder, fennel and pepper 20 grams each, slightly roasted and made into superfine powder, mixed with crystal sugar, and 1 spoon of this could be added in a cup of milk, and 2 to 3 strands of uh, camphor, saffron. Then, as a person ages, emotions, expectations also change. Similarly, senile changes in the eyes. Age-related macular degeneration, we have lenticular opacity, all this. So we need to take care of to stop aging. Before we can really stop the presentation, my take home message will be donate eyes, let our eyes live forever. So it comes at the end of every person's life. So we can always pledge our eyes, and the people who are there after we are gone will see that we donate our eyes. So our eyes are seeing always. So to do this, eye care is a lifetime responsibility. It has to include Pada and Shirobhyanga. Pada and Shirobhyanga is massage of the head and the body and the feet. This gives very good improvement not only in the vision but also general health. Palming and pranamudra to be done. Dhyana and pranayama should be our everyday activities. So we have a lot of things that can be taken care of so that we preserve vision. So, thank you for giving me this opportunity to be sharing my thoughts, and thanks a lot to everybody giving this a patient listening. Thank you.